Hi, Leslie Robinson here from Primal Health and Wellness. Welcome to part two of our three-part video series on the liver. So last week we talked about functioning of the liver and what exactly the liver is. Today we're going to be talking about a newer disease that came out in the 80s titled non-alcoholic fatty liver disease. So when we usually used to hear about fatty liver disease, it was caused by alcoholics or by excessive alcohol. All of a sudden we started seeing in 1980 a rise of non-alcoholic fatty liver, which is where the fat inside and outside of the liver is actually caused by food and not by alcohol. In order to get into a little bit of the history, I want to tell you a little bit of a story first. So prior to the 1960s, everybody ate kind of a farming diet. Like the way we grew up on the farm, you'd get up in the morning, you had eggs and bacon every morning, you used real butter, you used real cheese, you used whole milk, a lot of times on homogenized milk. That's the way we grew up. And back in my days, and even more so in my mother's days in the 40s and 50s, people were very thin. So they ate like that, however, they were thin. Much different to the way we see people today, where you can go to a school and the majority of kids seem to be not obese, but overweight, and you have some that are obese, but it's the people's structures have changed. So prior, like early on in the 1950s, you had President Eisenhower, who of course in 1955 had a major heart attack. He did have a heart condition though, but this kind of sent the people into a tizzy because heart attacks were not common at that time. So they were trying to decide, how did Eisenhower have this heart attack? What caused it? And men were starting to get panicky about it. So all of a sudden, this physiologist came onto the scene in 1958 named Ansel Keys. He did a little bit of studying. He had his own hypotheses, and he did a study on 7 countries, which were actually originally 12 countries, but he found that his hypothesis wasn't proven if he did that, so he shortened the study down. And he came up with the idea that the reason why Eisenhower had a heart attack was because he ate fat. Now that study has been disproven over and over again, and we know that not to be true. But back in the days, that led to 1960s to the 1980s, and still some people today actually believing that a high fat diet was bad for the system, and we needed to increase carbs, increase fruit, increase sugar. All of that was better, and we went into that high carb diet, low fat diet. And we saw the introduction of trans fats and a lot of industrial food. All of a sudden, come 1980, we started to see the rise of this liver disease that at first people couldn't figure out. Why is the liver getting fat? This is supposed to be very healthy. This, low fat, high carbohydrate diet was supposed to be, the epitome of health. Where all of a sudden, 20 years later, we're seeing diabetes rates triple. We're seeing obesity rates quadruple, and we're seeing non-alcoholic fatty liver disease come on the scene. So we know that non-alcoholic fatty liver disease is caused by food. It's caused by carbohydrates and an increase of carbohydrates, and it actually causes that fat to congeal inside the liver and out, and then cause death of cells. So what exactly causes it? So it has to do with insulin resistance. The normal United States or North American diet would say the liver can't really process more than 50 carbs of sugar a day or carbohydrates, remembering that things like rice, pasta, breads, some root vegetables, starches, they all can, when I say sugar, they all convert into sugar in the liver. So when we're talking about carbohydrates, anything that's high on the high glycemic index. So when you have insulin resistance and you're eating a high carb diet, anything over what they would say 50 grams, what we in the holistic world would say 20 grams, is stored as fat in the liver. So the liver just continues to get that layer of fat around it and inside of it and starts to not function. Metabolic syndrome, which we're seeing more and more of now, is also a large contributing factor to non-alcoholic fatty liver disease. So that again is increase in simple carbs, sugar, fructose. We're seeing it's starting to lower a little bit now, but back about 10 years ago, everybody was into juicing. So you put like 5 different, fruits in this blender and you make a fruit juice. It's supposed to be healthy. But we have to remember, when we remove fiber off of a food, that increases the transit time of the sugar getting to the liver, creating even more fat in the liver. So this was where we were starting to see the rise of non-alcoholic fatty liver disease. Obesity and lack of exercise, of course, will contribute. Now, two that are not talked about but have been proven over and over again is a lack of choline. So choline deficiency and methionine deficiency. Now, methionine is an amino acid, and choline is a B vitamin. So when people are lacking those, which interestingly enough are found in eggs, dairy, and meats, when we're lacking those and we're deficient, it increases the fat in our liver. So those are the main causes of non-alcoholic fatty liver disease. Now let's look at the symptoms. So interestingly enough, as nutritionists, when people come into the office, when we see someone who looks pregnant, or someone who carries all of their weight here around the midsection, then we know the liver's not doing well. So people will come in and they'll say, well, how many crunches do I need to get rid of this fat here? It's like, it doesn't work like that. If you're carrying fat here, 80 to 90% of the time, it's going to be a compromised liver. It's going to be a fatty liver that's not functioning well. So that is going to be one of the signs. But really, non-alcoholic fatty liver disease is asymptomatic, meaning there's no symptoms until the liver actually starts giving out, which is the end stage. So it goes from non-alcoholic fatty liver disease to NASH, and then cirrhosis of the liver, where the liver actually begins to die. That's where you've seen my husband draw those black spots. That's where cell death is actually occurring in the liver. Some of the symptoms also include decreased energy. You may just be tired all the time. You just don't have energy for anything. You'll get bloating. You'll get regional pain, so pain in the liver area. That pain then can radiate up to right shoulder pain and right rhomboid pain on the back, and headaches located on the right side. And then when it progresses, the latter end of non-alcoholic fatty liver disease, if you pull down your eyelids, you'll start to see yellowing of the eyes and even yellowing of the skin. That tells you that your liver's not functioning. So I wanted to talk a little bit too about how they came up with the amount of sugar or carbohydrates the liver can process. Because when they started with this original diagnosis of non-alcoholic fatty liver disease, it was discovered that 50 grams was the maximum carbohydrates, which again turn into sugar, that the liver can handle. However, for us in holistic nutrition, we would bring that down even lower. We would say 20 to 30 carbs a day is what the liver can handle. Now, that would put you into a low carb diet or a ketogenic diet. And that's why when you do start those diets, the weight comes off the organs first. I just want to give you a little interesting fact of what, say, a normal breakfast. If you were to ask, you ask just someone generally off the street what a healthy breakfast in it is. If I was to say, well, if you had a banana with an Activia yogurt and maybe a 6-ounce glass of an organic unsweetened orange juice, that would be good. That would be healthy, right? Until we look at the carb content and the sugar content of that. So one medium banana would be 23 carbohydrates. Remembering the liver can only process 50 grams of carbs. Now the Activia yogurt, say it's strawberry, it's blueberry, is 7 grams of carbohydrates. Now you're adding the unsweetened orange juice. There's nothing added to it. It's organic orange juice, 23 grams of carbohydrates. So here we have a total of 53 grams of carbohydrates, already over what the liver can handle that day. And you still haven't had lunch, you haven't had snack, you haven't had your other fruits that you're going to have during the day. So you can see how that actually will contribute to that excess fat. If you're an athlete and of course you're, working out like an animal for 4 hours a day, you could get away with that. Or if you're a child and your liver's still functioning really well and you have that high metabolism, you can get away with that. But when you're, 30 and up and, your body starts to age and your metabolism slows down, This is a train wreck waiting to happen. We know approximately 25 to 40% of the population has some form of non-alcoholic fatty liver disease. And we know that when it was developed, we started noticing it coming on the scene in 1980, interestingly enough, the people we were also noticing it in was vegans and vegetarians, because that doesn't make you exempt. Because remember, we're needing that meat, we're needing that protein, we're needing that fat, which again, we're coming back to choline deficiency and methionine deficiency. So it's really important that we have a balanced diet, which we're going to talk about the next video. What I don't like to use the term diet, but what form of eating is going to make the liver very happy, and how can we go into a liver cleanse? That's what we're going to be talking about next. But I'm hoping this gives you kind of a good picture of non-alcoholic fatty liver disease. You can always do your own studying on it too. As I'm always going to add, make sure when you watch the video that you please like, you share, you comment, and not just to comment on the video. I'm not here to kind of be up and center on these videos. I'm here to teach people about nutrition. So when you know people that are struggling with some of this, my job is to give the information to you. But now your job, once you see the video, is to get the information to your loved ones and people that you know need to get healthy. That's where I'm a success. When you can pass that on, you can learn and pass it on to someone that you love. So remember to like, share, subscribe, comment. You can find me on Instagram, Primal Health and Wellness. You can find my website, primalhealthwellness.ca, and I'm on Facebook, Primal Health and Wellness. So Leslie Robinson signing off, and I want to make you healthy.